Good girl, Lola.
Just weeks ago, 3-year-old Lola Rose was in a coma. British doctors told her parents she had hepatitis, her liver was failing, and she needed a transplant to survive.
I cried non-stop for like 4 days, just repeatedly. I'd be crying at the littlest thing.
Her father was able to donate a piece of his liver. Days after the surgery, their happy toddler was back.
They knew what was wrong and they knew how to treat it.
What doctors don't know is exactly what caused it and whether they're seeing an actual increase in cases.
This is, at the moment, still an incredibly rare disease.
The WHO has identified a small surge of at least 169 cases of acute hepatitis in children in 12 countries. 17 needed liver transplants, and 1 child has died.
There's no question about the fact that this is not related to COVID vaccines.
The vast majority of these children were too young to be vaccinated, and while 20% of them had COVID, doctors doubt that virus is responsible. Part of this mystery is that none of the children were infected with a virus that usually causes hepatitis. Instead, 75% were infected with an adenovirus, which usually leads to common cold symptoms.
Could this be a new hepatitis virus, or could this be a new viral syndrome that also involves the liver?
He notes hepatitis or inflammation of the liver can also be caused by exposure to chemicals or alcohol. Doctors here are now monitoring for cases.
There's definitely investigation of severe hepatitis cases going on in Canada. We don't know if these are the same syndrome or fit the exact definition.
Symptoms often include jaundice or yellowing of the eyes and skin and dark-colored urine. But doctors insist severe cases remain rare, and most children make a full recovery. Christine Birak, CBC News, Toronto.